There's a quiet kind of pain that sneaks into your life as you age. It doesn't shout or make a dramatic entrance. It simply lingers. One day you notice it while reaching up into the cupboard. Another day it flares up when you try to lift a kettle, hold a grandchild, or even pull the covers over your shoulder at night. It's not your shoulder, not quite your wrist. It's that stubborn, aching joint in the middle, your elbow. And let's be honest, elbow pain isn't something most people talk about. It's not as famous as knee or back pain. But for seniors, elbow joint pain can be just as debilitating, quietly stealing your strength, independence, and confidence. The elbow, after all, is involved in nearly every upper body movement. Whether you're brushing your hair, holding a phone, or using a spoon, the elbow is working. And when it's in pain, life gets complicated. For many older adults, this discomfort can come from years of wear and tear, arthritis, overuse injuries like tennis elbow or golfer's elbow, or even poor posture and reduced circulation. And unfortunately, as we age, the healing process slows down, meaning aches that used to vanish in a day can now linger for weeks, even months. But here's the truth. You don't have to accept elbow pain as part of aging. There are safe, effective movements that can restore mobility, reduce inflammation, and even prevent the pain from coming back. No pills, no injections, no fancy gym equipment. In this video, we're going to walk you through 5 simple, doctor-approved elbow joint relief exercises specifically designed for seniors. You can do them all from the comfort of your home, sitting or standing, and without any equipment. These movements target stiffness, improve circulation, and gently strengthen the muscles and tendons around your elbow. So if you've been living with pain every time you extend your arm or bend your elbow, stay with us. Relief is not just possible, it can start today. Exercise 1, elbow flexion and extension. Restore natural movement. Let's begin with one of the most essential movements for elbow recovery, elbow flexion and extension. It sounds simple, and it is, but this movement plays a critical role in restoring joint health, especially in aging arms that have become stiff or painful due to inflammation, arthritis, or disuse. Over time, joints can lose their natural fluidity. Synovial fluid, which keeps our elbows moving smoothly, begins to decrease with age. That's when you start to feel grinding, tightness, or even sharp pain. This basic movement helps restore circulation, warm up the tendons, and gently wake up the muscles around the joint. How to perform. 1. Sit upright in a sturdy chair with your feet flat on the ground and back straight. You can also do this standing if you prefer. 2. Keep your upper arm close to your side, allowing your elbow to act as a hinge. 3. Slowly bend your elbow, bringing your hand up toward your shoulder. 4th, hold for 2 to 3 seconds, then slowly extend the arm back down until it's fully straight. 5. Perform this movement slowly and with control. Avoid jerking or snapping the arm straight. 6. Repeat 10 to 15 times per arm, once or twice per day. Pro tip: if you feel any pain, reduce the range of motion slightly. The goal is not to push through pain, but to invite the joint back into healthy movement. Why this works? This motion restores your natural elbow range, lubricates the joint, and stimulates gentle blood flow. It's especially good for people with osteoarthritis, bursitis, or post-injury stiffness. Because it doesn't require any weight, it's safe even for seniors recovering from a recent flare-up or surgery. Benefits: improves joint mobility, reduces stiffness and inflammation, prepares the elbow for more advanced strengthening later, promotes healing by increasing circulation to the tendons and ligaments. Starting with this movement creates a strong foundation, and it's one you can do daily, even while watching TV or sitting on the porch. It's gentle, restorative, and a perfect entry point for healing elbow pain. Exercise 2, wrist rotations. Relieve tension and strengthen the forearm. When you think of elbow pain, your wrist probably isn't the first area that comes to mind. But here's the secret. Wrist health is directly connected to elbow function, especially for seniors. That's because many of the muscles and tendons that control the wrist actually originate near the elbow. These include the extensor and flexor tendons, which travel through the forearm and connect to the elbow joint. When these tendons become tight, weak, or overused, whether from years of lifting, typing, cooking, or gardening, they can cause strain right where they attach at the elbow. This often results in conditions like tennis elbow or golfer's elbow, even if you've never played a day of either sport. That's why the second exercise, wrist rotations, is essential. It improves flexibility and strength in the wrist and forearm while taking pressure off the elbow joint. How to perform. 1. Sit or stand with your back straight and shoulders relaxed. 2. Raise both arms in front of you, keeping your elbows bent at 90 degrees and tucked close to your sides. 3. Make a gentle fist with each hand, not too tight. 4. Slowly begin to rotate your wrists outward, turning your fists away from your body. 5. Then reverse the motion, rotating them inward toward your body. 6. Complete 10 to 15 rotations in each direction, keeping your elbows still and only allowing movement at the wrist. Pro tip: move slowly and focus on the quality of the rotation. You might hear small clicks or feel slight resistance at first. That's okay. It's your body responding to the new motion. Why this works: wrist rotations activate the forearm extensors and flexors, relieve tendon tension near the elbow, and improve joint coordination. It's a great warm-up for people with chronic elbow issues and also serves as a low-impact strengthening move. Benefits: reduces tension in the tendons attached to the elbow, enhances circulation and flexibility, strengthens forearm muscles to support elbow mechanics, helps prevent repetitive strain injuries in the future. This simple move takes less than 2 minutes but can offer long-lasting relief, especially if your elbow pain is triggered by forearm overuse or poor wrist flexibility. Exercise 3. Forearm self-massage and compression release. Loosen tight tendons and ease elbow tension. Sometimes relief doesn't come from stretching or strengthening. It comes from releasing what's already tight. That's why our third technique isn't a traditional exercise, but rather a targeted self-massage technique that's incredibly effective for seniors dealing with elbow pain caused by tight forearm muscles and inflamed tendons. If you've ever experienced tenderness just below your elbow or aching when gripping or turning objects, chances are your forearm muscles are pulling too tightly on the elbow joint. This is often due to repetitive motions and age-related stiffness in the flexor and extensor muscle groups. The result? Pressure builds up in the elbow region, and pain follows. This forearm self-massage technique is a gentle way to release that pressure and restore natural mobility. How to perform. 1. Sit comfortably at a table or with your forearm resting on your thigh. 2. With your opposite hand, locate the area just below the elbow joint, the meaty part of your forearm. 3. Using your thumb or fingertips, apply gentle but firm pressure to this area and slowly move your hand downward toward the wrist. 4. Move in slow, even strokes, following the path of the muscle fibers. 5. If you find a tender spot or a knot, pause there and gently press for 10 to 15 seconds, breathing deeply to help the muscle release. 6. Spend 2 to 3 minutes massaging the top, extensor side, of the forearm, and then repeat on the underside, flexor side. Pro tip: you can apply a warm towel to the area before massaging to soften the tissues. This is especially helpful for seniors with arthritis or cold-sensitive joints. Why this works: tight fascia, knots, and inflamed tendons in the forearm are a hidden cause of elbow pain, especially in older adults. This massage technique boosts blood flow, reduces inflammation, and breaks up adhesions that prevent smooth movement in the joint. Benefits: relieves deep muscle tension and myofascial restrictions, improves tendon elasticity and mobility, reduces strain on the elbow joint, promotes healing through increased blood circulation. It's simple, safe, and surprisingly powerful. Many seniors notice immediate relief after just a few sessions of forearm compression release. When combined with other mobility exercises, it becomes a game changer for elbow recovery. Exercise 4, isometric elbow holds. Rebuild strength without movement. Elbow pain can make movement feel risky, even frightening. For many seniors, the fear of aggravating an already aching joint keeps them from staying active, which sadly leads to more stiffness, muscle loss, and even worse discomfort. That's where isometric holds come in. These are strength-building exercises that don't involve movement, making them ideal for sensitive joints or early rehabilitation. In this exercise, we focus on activating and gently strengthening the muscles around your elbow, especially the biceps and triceps, without bending or extending the joint. It's perfect for those with arthritis, tendinitis, or post-injury weakness who want to regain muscle tone and joint support without risking further damage. How to perform. 1. Sit comfortably at a table with your forearm resting palm up. 2nd, place your opposite hand gently over your working hand, palm against palm. 3. Now try to bend your working arm upward, resisting the movement with your opposite hand. You're not actually moving the arm. You're just creating tension by pressing against it. Hold this tension for 5 to 10 seconds, keeping your upper arm still and engaging your biceps. 5. Release and rest for a few seconds, then repeat. 6. Do 8 to 10 holds per arm, once or twice per day. To work the triceps, switch the direction. 1. Turn your working palm facing down and press down against your other hand, resisting the motion just as before. 2. Again, hold the tension for 5 to 10 seconds, then release. Pro tip: breathe naturally throughout and avoid holding your breath. Focus on engaging the muscles, not overexerting. Why this works? Isometric exercises are incredibly joint-friendly. They allow you to activate muscles and build strength without moving through a full range of motion, perfect for seniors with chronic elbow discomfort or after a flare-up. Benefits: builds strength around the elbow without stress or impact, supports joint stability for everyday movements, enhances muscle tone in the upper arm, safe for arthritis and post-injury recovery. When done regularly, isometric holds can restore confidence in your elbow strength, giving you the power to reach, lift, and hold without hesitation. Exercise 5. Towel squeeze. Boost grip strength and elbow support. It might surprise you, but one of the most effective ways to ease elbow joint pain isn't found in your elbow at all. It's in your grip. That's right. The strength of your hand and forearm muscles plays a major role in how much pressure and strain is placed on your elbow. As we age, we naturally lose grip strength, which leads to overcompensation in nearby joints, especially the elbow. The muscles in your forearm that help you grip tightly are connected by tendons to the elbow. When those muscles weaken, everyday tasks like holding a pot, gripping a pen, or opening a jar place more tension directly on the elbow joint. The result? Chronic pain, inflammation, and reduced function. The good news is you can reverse this, and you don't need fancy tools, just a towel. How to perform. 1. Sit comfortably with your back straight. 2. Take a small towel and roll it into a thick cylinder, about the size of a soup can. 3rd, hold the towel in one hand, resting your elbow on your thigh or a table. 4. Squeeze the towel firmly for 5 seconds, focusing on engaging your fingers, palm, and forearm. 5. Release the squeeze slowly, rest for a few seconds, and repeat. 6. Perform 10 to 15 squeezes per hand, switching sides afterward. Pro tip: use a soft washcloth if your grip is weak, and progress to a thicker towel as your strength improves. Why this works? The towel squeeze targets the deep flexor muscles of the hand and forearm, which are key players in elbow health. As these muscles become stronger, the tendons at the elbow are better supported, reducing strain and inflammation. Benefits: strengthens grip and forearm stability, reduces tendon stress at the elbow, improves function for daily tasks like opening jars or holding tools, builds support from the hand up to the shoulder. This final movement ties everything together, encouraging total arm health from fingertips to elbow. It's simple, it's low impact, and for seniors, it's a game changer in regaining control over your upper body strength. Lifestyle tips for long-term elbow relief. Exercises are a powerful start, but true lasting relief from elbow pain also comes from what you do the other 23 hours of the day. If you're a senior dealing with chronic elbow discomfort, these lifestyle adjustments can help reduce flare-ups, support healing, and preserve your joint function over time. Let's look at the daily habits and routines that support elbow health. 1. Stay gently active. Throughout the day, elbows don't do well with long periods of stillness. If you spend hours sitting or keeping your arms in the same position, the synovial fluid in the joint stagnates, causing stiffness and discomfort. Set a gentle reminder to stretch your arms every hour or so, especially if you're reading, watching TV, or using a phone or tablet. Apply heat in the morning, cold at night. A warm compress or heating pad can loosen tight tissues and boost circulation when you wake up. At night, if inflammation builds up from the day's activities, a cold pack for 10 to 15 minutes can reduce swelling and soothe discomfort. Rotate between the two based on how your elbows feel. 3. Use joint-friendly tools at home. Heavy lifting and awkward hand positions can worsen pain. Use jar openers, ergonomic handles, and lightweight cooking tools. Even something as simple as using both hands to lift a heavy mug can reduce stress on one elbow. 4. Sleep position matters. Try sleeping with a pillow under your arm to keep the elbow slightly bent and supported. Avoid tucking your arms under your pillow or body, which can compress the joint and lead to morning pain. 5. Watch for nutritional deficiencies. Vitamin D, magnesium, and collagen play key roles in joint and tendon health. Talk to your doctor about safe supplements or foods like leafy greens, fatty fish, and bone broth to support tissue repair from the inside out. These habits, when combined with the 5 exercises we just covered, create a supportive environment for healing, and more importantly, prevention. Elbow pain doesn't need to be a permanent part of aging. Let's take a moment to reflect. You've just learned 5 simple, senior-friendly exercises that don't require a gym, weights, or special equipment. Just a willingness to start moving again. Each movement, from gentle flexions to targeted towel squeezes, serves a purpose: to reduce pain, improve strength, and restore freedom to your daily life. But these aren't just exercises. They're a signal to your body that you're choosing to stay mobile, strong, and independent. No matter your age, elbow pain can be discouraging. It might make you feel like your body is betraying you or like you're losing your ability to care for yourself. But here's the truth. You're not helpless. Your body still listens. And even the smallest movements, done consistently and mindfully, can bring lasting change. So here's what you can do next. Try these exercises every day for the next 7 to 10 days. You don't have to do them all at once. Even 2 or 3 will make a difference. Combine them with the lifestyle tips we discussed to support healing from the inside out. And most importantly, listen to your body. Move gently, breathe deeply, and celebrate every bit of progress, no matter how small. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss out on new health tips, tailored just for seniors like you. And share this video with a friend or loved one who's also struggling with elbow pain. They'll thank you for it. Your journey to pain-free living starts with just one movement, and you've already taken that first step.